like to introduce the first presenter, Professor Sundari Ravindran, and she's the professor at the Achutha Menon Center of the Health Science Studies, Chitra Tirunal Institute for Medical Science and Technology, Trivandrum, and visiting faculty at the School of Public Health at the University of Witwatersrand, Johannesburg, South Africa. And she's also a former co-editor of the international journal Reproductive Health Matters, and is currently a member of its editorial advisory board. And she's a founding member of the RORE, Right-Oriented Research and Education in Sexual and Reproductive Health, an international network of the national coalitions of maternal neonatal health and safe abortion India, established in 2006. And today, she will present a very interesting paper with a very interesting title also, The Gordian Knot, Equitable Access to Sexual and Reproductive Health Care in an Area of Neoliberal Globalization, which questions the feasibility of advancing equitable and universal access to sexual and reproductive health care in the region, in the area of neoliberal globalization. Yeah. Please welcome Sundara. Yeah.
Good morning. And it's indeed a privilege to be here and to address this topic of the feasibility of achieving equitable access to sexual and reproductive health and rights in an era of neoliberal globalization. And I call this the Gordian Knot. What's happening? Yeah. The central thesis of my talk today is that in an era of neoliberal globalization, achieving equitable access to sexual and reproductive health and rights is a knotty and a very difficult challenge. That even as we move forward in achieving some gains, we are constantly having to run to stay in place. And this is not only because of the various challenges that have already been mentioned in terms of conservatism, religion, in the name of religion and culture, but also because of larger economic and social forces that undermine health and well-being of all people. And I believe that seeing the connections between these larger macro forces and our very local fights, our very local challenges is probably the first step towards our quest to achieve equitable access to SRHR. Without going into a great introduction about what neoliberalism is all about, I would jump straight to what are some very well-known implications in terms of economic policies, and these are only a few examples. One, which is liberalization of trade, removing trade barriers across countries and allowing foreign direct investment, including in the health insurance sector and in various social sectors. Promotion of export-oriented growth, including in agriculture, which has its implications for food prices, food crisis, and so on. Any unproductive public expenditure is discouraged, which has an impact on subsidies in agriculture, regulation of the market to assure minimum prices, balancing the budget, also known as fiscal discipline, which includes cuts in public expenditure that immediately affects us, in health, in social services, and in education. And all these supported by GATS, by TRIPS, and many other WTO, World Trade Organization treaties, and supported by international financial institutions. A mouthful. So what does it really mean to all of us? Yesterday, in the keynote, they presented about increasing income inequalities, and increasing income and wealth inequalities is being talked about very widely. But where does that really come from? It really comes from the path of development that has been in force for the last several decades. And there is a very definite change in the Asian region, where except for a few countries where there are deliberate policy interventions, inequality has increased in very, very sharp measure. And this is about the Gini coefficient, increase in or change in Gini coefficient. So what are the implications for lives and livelihoods of people? For a number of reasons, displacement of small and marginal farmers, including because of climate change, drought, volatile prices, no longer subsidized agricultural inputs, a whole range of reasons that destabilizes small-scale agriculture, people buying up land for real estate and holiday homes, distress-led migration from rural to urban areas, and urban areas offering many opportunities and at the same time providing the opposite of harming health and well-being, with jobs in urban informal sectors, vulnerable and hazardous jobs, insecure housing, and so on. There are also new opportunities for women in the export promotion zones. So on the one hand, women are empowered in that they are no longer dependent within and controlled within a family structure, but they face other exploitation. And there is also, in this region particularly, international migration of men as well as women in jobs that are insecure and can be even personally insecure. Along with this is lack of public investment in basic amenities like water supply and sanitation and infrastructure, which actually increases women's work burden. It also increases lack of public safety for people, increasing cost of food because of repeated food crisis, and a number of international factors there of futures trading in food, biofuels production, and so on, which actually means more hunger, or no hunger but less nutrition. But I think the worst of all is the ideology of neoliberalism, which we don't even know or recognize as existing. So in this ideology, competition is the defining character of human relationships. Inequality is not problematic. The market ensures that everyone gets what they deserve. So if you didn't make it, too bad, it's your problem. Those with power and resources are supposed to have acquired it through merit, ignoring the advantages that they have had in order to secure it. And structural problems are recast as individual failures. The poor begin to blame themselves for their failure to find employment or secure good education or health care for their families. And this has implications for population well-being. So widening inequalities cause fissures in the social fabric by religious, caste, ethnic conflicts increasing. Everybody thinks somebody else around them is responsible for their very bad situation. Intolerance of any diversity. So sexual, mental, physical diversity with threatened masculinities among men who are unable to find jobs and support their households, causing increase in social and interpersonal violence, especially against women and those with non-conforming gender and sexual identities. There's also intersection of multiple vulnerabilities by gender, class, sexual orientation, and so on, with the marginalized rendered invisible and blamed for their marginalization. And all these things, hunger, low wages, hazardous living, have implications for sexual and reproductive health. So all these make people more vulnerable to getting sick. And what's happening with the health sector? Less public investment means less public investment in health as well. And barring very few countries here, you find that public investment in health as a proportion of government budgets has been going down, and the commercialization of health services has been actively promoted, and then we worry about catastrophic health expenditure. What does this do to sexual and reproductive health services? Sexual and reproductive health services, except to some extent for maternal health and family planning, has been always in the private sector, even before the ICPD. And if you want it to be available to everybody, universally accessible, what this really calls for is more and more public investment, not less and less of it. And external funding for sexual and reproductive health services, which as we saw yesterday, is actually dwindling, has fragmented comprehensive sexual and reproductive health into maternal health, sans abortion, family planning, usually for married women, and HIV/AIDS in many countries for special high-risk groups, while leaving out all other needs. And not even maternal and child health and family planning is fulfilling the universal access criteria. There's limited scope for making claims for new services. So for all of us who aspire for new services, for multifarious and diverse health needs, we need to factor this in. And catastrophic health expenditure is incurred to meet many sexual and reproductive health needs, or people remain with unmet needs. I'm sorry to have portrayed a very gloomy picture, but I think there is a way that we can begin to unravel the Gordian knot, and the agenda for action that I'm mentioning is not at all original. They have been around for a very long time, but never heard and never acted upon. So public investment directed towards sectors in which the poor work, areas in which they live, factors of production that they possess, and outputs which they consume. Sustainable management of natural resources, reorganization of food trade to guarantee local availability. These are only a small part of a larger agenda. And I think universal access to sexual and reproductive health should come as a demand, which is a component of a demand for universal access to health services, increased and sustained public investment, tax-based financing, and any other interim measures have to be consistent with tax-based financing, regulation of the private sector, regulation by entry by international private players, and containing costs of drugs and equipments. These are part of the larger demands. For sexual and reproductive health services in particular, in addition to everything else that we ask for, we have to challenge legislative restrictions on safe abortion and the limited availability of safe abortion services, even in countries where they are nominally legal, and demand the full range of sexual and reproductive health services to meet people's diverse needs, not MCH, not FP, not this bit and that. We want it all. And putting in place accountability and grievance redress mechanisms to hold health systems accountable for timely access to quality sexual and reproductive health care. Equitable access to SRHR is about seeking economic, social, and gender justice. And let us see the connections. Let us network with social movements, challenging discrimination and addressing macroeconomic and political factors on many different grounds. If they are fighting for access to drugs, it's part of our fight. If they are fighting for attention to climate change, they are fighting for our issues. So let's make those connections, let's join the dots, and let's move forward. Thank you.